Hello, in this video I'm going to teach you some soft tissue techniques, mainly for the quadricep muscles and a little bit on the lateral side for the IT band and the tensor fascia lata. The main muscle of concern is going to be the rectus femoris, and the rectus femoris comes from the anterior inferior iliac spine on the innominate bone here and comes down, and then it crosses into the quadricep tendon, into the ligamentum patelli, and attaches onto the tibial tuberosity. And typically the rectus femoris is the muscle out of a quadricep group that becomes short and tight. The tensor fascia lata muscle is on the lateral side of the ASIS, comes down as the iliotibial band or tract, crosses the lateral side of the knee and inserts onto a tubercle known as Gerdy's tubercle. And the IT band, working with the TFL, is mainly an abductor and a hip flexor. There was a study done that shows that you need 925 kilograms to lengthen the IT band 1%. So what I suggest is we don't tend to spend much time treating the IT band in itself, knowing that the study shows that it's almost near impossible to lengthen it. We can choose to work around the TFL because that is the muscular component of the fascia lata. So what we're going to do, I'm not going to use my thumbs as such. I try to avoid them. Sometimes when I teach my students, obviously it's not going to happen, but I almost say to your students, imagine that you cut your thumbs off and you place them into your back pockets. So you almost don't have thumbs. Why? Because the joint, the carpometacarpal joint where the trapezium is located here, is one of the first joints to become arthritic. And many soft tissue therapists use their thumbs too much. So I suggest you try, if you can, to avoid using these often. So what we're going to do, every movement I use, I get the patient to get involved. So what that means is either my patient actively contracts the muscle to self-generate motion, or I use a passive motion. Passive motion for this one is not so easy. So this is going to be mainly like an active release motion, rather than a passive release. So the way we're going to do it first of all is the patient is going to start with a leg in extension here. And you can see the lateralis muscle, you can see the vasti muscle here, and also the rectus femoris overlies that on the side. The IT band would be roughly where my fingers are, and then obviously it covers the lateral side here. Now, so you can see that the muscle is solid and is in a contracted state. So to mobilize it or to lengthen the tissue, my patient is slowly going to bend the knee, so they are going to eccentrically lengthen the quadricep group whilst I treat the tissues. I tend to start with fingers and I reinforce, and I try to keep my arms relatively straight if that's possible. So let's start. I can either start with my left hand and reinforce, or if it's easier for some, you can use your right hand and reinforce. So I'm going to start around the quadricep tendon, and then I'm going to slowly apply pressure. It's hard to say how much. I don't want to apply too much pressure because I will limit what my patient is doing. So I have to allow them to go through the motion whilst I glide over the tissues. So I'm going to apply some pressure here. So from here, it's almost like a sort of like a lean in lunging. What I don't want to do is just stand straight and just bend and do the motion. Okay, so I'm going to try to look after my posture every time. So when you're ready, Max, can you slowly, and I normally might say take a breath in, please, which means I breathe in as well. And as he breathes out, slowly bend your knee. Okay, so you slowly bend, so keep going. And I'm gliding through, nice and slow. Now, my patient will go as far as he can, but I'm probably almost halfway. So what I suggest he does, he comes back up again, and then we repeat the same process. So fingers, apply pressure, and then my patient then, with the breath out, they then flex the knee, and I'm gliding up towards the origin of the rectus femoris. And again, we still have almost a third to go, and then we can apply again. Off you go, and you can glide through the technique along here. Be careful where you're approaching because you can see that the clothes are obviously down here. So if you wanted to treat higher, you can do one of two things. You can either just roll up the shorts with permission, okay, or you can get your patient to hold that area and pull up a little bit. Okay, so now when you glide up, your fingers will only touch their fingers and they're not going to go underneath the shorts. Okay, so just bear that in mind. You can relax there for a sec. Now from there, Same again, you can go into the lateralis, off you go. So the patient knows the motion, okay? You can see if I'm pushing, I'm going to bunch up the tissue. So I almost have to allow the gliding to become effective here. There we go. And now I can glide through that. Okay, I suggest you start relatively light and you can increase the pressure. If you don't particularly like one side, change over, change angles. Okay, I can lean here, off you go, and I can glide through like this, and I can blend my fingers around. See, come back up, take a breath in, and as he breathes out, off I go again, and I'm gliding through that. On the medial side, medialis here, take a breath. You can see he naturally turns his leg out a little bit, and off you go. So I'm going to glide through as he's bending. So I can work through that. What you can do if you want to, you can almost do like a muscle energy technique, but it's a modified version. If you said to your patient, just push against my hand, so he is extending, activating the quadriceps for at least 10 seconds, it is known as a post-isometric relaxation of muscle energy technique. After 10 seconds, we've got what I call a window of opportunity, where the muscle is in a relaxed state. Take a breath in, please. And then you repeat the process. Okay, so you're doing the same technique, but you glide in through as he bends his knee. So this would be a PIR effect whilst actively going through the tissues. And that works really well. You can, if I do this technique, okay, if I place my hand here and I got my patient to pull against me, okay, now this is called an inhibition technique. So he's activating the hamstrings, but now the tissue is almost, pull it maybe a bit more, okay, and then the tissue is now slackened. You could just maintain this position, and I could just glide through the tissues whilst he's isometrically contracted. So I can glide through the tissue a little easier, even though he's contracting the hamstrings and there's no motion occurring. So it's an isometric, but it's like an RI, a reciprocal inhibition technique. And you can also do this one, overcome me, Max, okay? So you resist against me, so you keep pulling. So you would pull down, and I glide, so I'm allowing him to do the movement. So now it's a concentric contraction as I'm gliding through. So we can do that technique as well. Quite soon I'll use my knuckles, okay? So my arm is straight like this. You can see I lead with my thumb. Everything is straight. Try not to roll your hand over like this. So keep everything straight. And it's a movement coming from the shoulder, not from the elbow of the hand or wrist. So you keep the arm straight, whichever arm you decide to use. And when you're ready, Max, just slowly bend that knee. So you are gliding down through that, and you are working through. And you can do it in stages. Come back up, take a breath in. I'm going to change my angle. So I'm going to go around the lateral side. Good, and ease off. And I'm going to come a little bit on the side here. Just watch your wrist in this one. From there, onto the sort of IT area. Not quite, but I'm going to cover a little bit onto that fascia lata sort of tissue as it connects down from the TFL along here. We'll do another video where we can talk about IT at a later date. Now, so you can use the sort of like the knuckle to do that, and that works really well. But you can also apply the wax. This is a wax by Songbird. So I don't tend to use oils or creams, just a little bit on the forearm area. Hold onto the wrist, just drop your body weight down like this. And then from there, this covers a wider area. If you change the angle, you can pinpoint it. If you increase, you can increase the surface area. So in this case, so it's as wide as we can get. When you're ready, Max. So he is literally same movement, bending the knee, and I'm gliding through the tissues, nice and slow and controlled. He'll go as far as he can. I can ease off, take a breath, and as he breathes out, I can then glide through the area. By changing the angle, so by changing it, so if I just tilted my elbow into flexion, now the focus is going to be more on the medial side. If I change the angle again, here, from there, off you go. The focus is more on the lateral side. And then we can work up as far as you feel is appropriate. The more you are on this lateral side, you're also going to get a little bit of the TFL as well. And I suggest you treat the TFL with those techniques before you do anything towards the IT band. So there's some simple soft tissue techniques for mainly the quadricep muscle group.